I wanted to make a small announcement in a sense that this was developed in collaboration with Fatima Afsari. She is a postdoc in our lab. And I'll be talking about generative AI in pathology and potential to bring this in clinical practice. So as you all know, the generative AI, as the name suggests, right, that it's kind of known these days in a sense that this generative model that you all possibly are familiar with, chat gpt, right? And this is kind of a generative method. And we all were also talking about using clinic scribes, right? AI scribes during the last faculty meeting. Right. So all these are kind of related, but the question comes, right, more and more AI we use, where we are leading to. So that being said, if I go back to a broad picture of use of AI, right, with the ultimate goal of bringing this system to clinical practice, right, any project in clinical domain, it start with a discovery, especially in pathology and possibly AI-driven pathology, where it starts with a discovery, right, in big picture, where you see something in a tissue slice or make an observation. You go for a preclinical development with a mouse model, go for then early clinical trials where you uh, basically review the potential of this new technology for clinical deployment. Then further late clinical development happen, which are the late stage or more mature development to look for more market potentials, where else this method can be applied, potential risk factors, and finally it's broadly used in diagnostics. So that's the typical framework for any sort of systems methods to to be applicable in diagnosis, right? And it's also true for AI driven pathology method. And again, it has nothing to do with generative pathology, but generative AI models, but I just mentioned just for completeness. That being said, I will also provide a little more background on on the use of AI technologies itself, because we are hearing like repeatedly AI, machine learning, and all, and again, right? So machine learning, just for everyone's recap, is a broad topic where we basically bring data. We bring like we look at data, for example, for example, name a few. If you are in the clinic today, you had some sort of data you are looking at for patient diagnosis maybe, or making some decision. Imagine like if you want to learn from that data some sort of pattern. In the case of images, these are image based patterns, so machine learning helps us to learn those patterns to do various tasks like classification, maybe regression, maybe segmentation. Deep learning deep learning basically is a deep learning is basically, hold on just one moment. uh, um, so deep learning basically is a area of deep learning basically is an hold on deep learning basically is an area of AI, right, where you use deep neural network or long neural network with which is kind of mimics the human brain to learn the pattern of data with a hope to make it more and more generalized. Right. Foundation models, imagine that if you have these deep learning models and now you want to solve a specific application, maybe solve some generalized set of problems like detection of inflammatory cells or immune cells, then prediction of disease, drug response. But you take maybe all the Shands hospital data or the data from the overall state of Florida and train a model and learn about the foundations from that data. And then finally comes in, like, all this different large language model and vision models, which are part of foundation models, but one part of them is called generative and one is non-generative. Generative means you generate or synthesize new data from the data. And again, what does it mean really? This is what we'll try to learn. And then non-generative are like the tasks like classification, segmentation, regression, things like that. So regarding generative AI model, these are some of the capabilities on the right side, and it's taken from this recent paper, Rashidi et al. Uh, so it's basically, it allows you to generate synthetic data. Synthetic data is useful for augmenting the data when the data is sparse or there is a scarcity of data to train new model. Generative AI model has application to image to text conversion. That means you take an image or pathology image, you can generate report. At least that is the hope, right? We were talking about AI scribe other day in the faculty meeting. Just think about like maybe one step higher, where instead of scribing, you want to just generate not only scribing but also learn something from the image during the process of patient treatment. Natural language processing, you all are familiar, you are handling. Possibly all of you here has used ChatGPT a little bit. So it's basically you give a text in and then it generates text out, right? Depending on the information, depending on the prior background. Audio and video processing, right? Audio and video processing is basically generating and converting audio and visual. For example, these days, right, we generate for this Zoom meeting, it is being if it is being recorded, it can be it can be transcribed, right? So, and it has a medical application. So with that background in mind, let us go back and go to a little more in depth of the basics of machine learning, so that we can come back and we can explain how the generative models work. So going back to the basics, I mean, in any yeah, computational work, right, in general, right, it doesn't have to be machine learning, AI, machine learning, or however way you want to frame it, right? Dimension of the data is what all matters, because this is where things start. And what does it mean by a dimension? Dimension is like, if you have an image, and forgetting about whether it has RGB, like, three colors component, imagine if you have 16 by 16 pixel image, right? It has about 256 different values. So it's a 256 dimensional vector that encodes the information in the image. Or it could be if it is a 256 by 256, it's 65,000 dimensions. It's exponentially it increases. And then what does it mean by that? Because if you have an image and if you are seeing again and again, if you are a like natural human being, we are trying to process that image versus even machine, we always process that level of dimensionality of the data which we process. And typically we humans are very good at that, in learning from that data. But when machines learn from it, there is something called cuts of dimensionality. Means larger the data space becomes, it becomes much difficult to handle with respect to generalizability, sparsity of the data, or data point distance. And there are ways to congest the information from the data. And we all are familiar with principal component analysis. I mean, it's a quite common in medical field as well, and there is a great commonality. And what PCA does, it's a way of doing computation using data, where we reduce the dimensionality information from the data to a tractable space where we can kind of make some sense of the data, yet we work with a lower dimension, right? So this is a great example. This is nephrology divisional picture, right? This is the original picture. We can see the size of 693 times 1024, about 709,632 dimension point here, right? And one way to reduce the information content from the data, yet handle that is principal component. Question is how many principal components are just enough to handle the data. So we can see 5 principal component reconstruction, it doesn't give enough much information. 20 principal component was not great, but 50 principal component is just there where we can still recognize different faces, right? 100 principal component was like the best. But when we are dealing with 100 principal component, right, it's basically nothing but instead of 709,632 data points with 100 principal component, it would become about 70,000 data points. It's about tenfold decrease in the data, right? Yet we can tractably work with the data. And why I'm mentioning about all this? I'm mentioning about all this because when a pathologist, right, or when you are looking at an image, right, in clinical context, right, you are really thinking along the same line. We do not really say, okay, this is the nephrology divisional picture with this person sitting on the right with a green colored leaf, and there is a yellow colored bird, right, at the right angle. Not like that way. When we are looking at a pathology image, we talk about a concept, and that concept is simply a glomerulus, right? Or we talk about tubules, arteries, arterioles, interstitium, interstitial fibrosis, peritubular capillary, tubular basement membrane, their disease, right? And those informations are actually kind of a vectorial representation of the data, means vectorial representation of the data in a sense that it's another way of dimensionality reduction. And we do that in clinical context all the time from very large data in clinical context, right? And this is where this is what an important concept to learn, where the similarity is in clinical context and machine learning. So these are basically so-called features we talk about instead of every pixels, right? So and this is the dimensionality we talk about. And then when you have this dimensionality there, right, then we talk about like the progressive pattern of the disease, right? Progressive pattern of the disease is whether a tubule is changing from normal to acute, to a pre-atrophy to atrophy, and this continuum, right, this can be described based on the clinical features, right? And that features, that dimensionality basically can be described as a continuum, right? And when we talk about that, there comes an important concept called manifold. So everyone is familiar, in this left side picture, right? It's a pastry, right? It's a three-dimensional object. But imagine like if every point here in this three-dimensional object is a data point or a point of those tubules, right? Which forms this three-dimensional object. Ideally, that three-dimensional object can very simply be presented using a two-dimensional form, because you can fold it and make a two-dimensional form, right? So in that two-dimensional form is shown in right, and you can see, if you see to this picture from this way, right, from toward the screen, you would see very clearly the pattern of the data. But if you see from the right side, left side or top, the projections you will get, that would lose the data representation, right? So that means in 2D, right, there is a pattern, right, that fits in the 3D space, which has all the information we need, right? So that means like when we look at the data, right, and data has this weird representation of multiple dimensionality, there might be a pattern in the data, and that pattern may or may not exist. But if that exists, we are lucky, and that pattern may represent the progression of the data, right? Which is basically the concept of manifold. So reduction of data from like multiple dimension to lower dimension could be projection. Principal component is one way, or manifold analysis. And finally, to give my brief on machine learning, I will give you a little background on what is hyperplane, right? So once we have these features, right, why we use those features? At the end of the day, doctors, when they look at the slide, they do some sort of disease diagnostics, right? And in order to do disease diagnostic, we basically do a natural classification in our brain, right? For example, we have Fisher iris data sets, right? This is a great example where you have iris vesicolor, iris setosa, iris virginica. and it has this sepal and petal, which has a length and weight, which could be our four features. Again, these are three different type of flowers. Their identifying feature here are not the pixels like in the medical domain. They are sepal length and wide and petal length and wide, and we'll take many such data or samples, and we'll try to separate them out. And we can see that if we just look at the sepal width and sepal length, or sepal white, I think this got little repeated, possibly I need to change that. Maybe Fatima just, oh, this is for setosa and virginica, and this is for setosa and vesicular, for two different cases, right? And we can see that, we can separate them using some sort of, some sort of hyperplane, which should be generalized enough so that the data is not overfit, because we really don't want to fit the line in such a way that we get this one as part of this class, right? It has to be generalized. And the whole concept here is that when you are diagnosing in medical domain, right, the features I mentioned, right, the features that doctors use as a concept can be thought as a high dimensional features. They might have some sort of pattern, or in the high dimensional place, or in the lower dimensional space, or in the manifold domain, they can be classified. And in this case, this data is simply classified. But the idea that I covered so far in data science and connecting with machine learning and corresponding medical domain are four. We talked about features, we talked about data dimensionality, we talked about the concept of dimensionality in medicine, we talked about concept of manifold, we talked about classification, right? So with that background in place, let's start understanding about what is generative model. And one, again, remember the example of generative model is what we deal with, right, in our phone, right, in chat GPT these days widely. So generative model is nothing but is the opposite concept. In the previously what I discussed, like image to feature, now we go opposite way. We take, so the most like simple concept is you take a random noise image and you generate a synthetic image. Synthetic image means fake image, means it doesn't exist in real life, but you generate from this random noise using AI, and you generate something that makes sense, okay, which would look like real, right? Basically that's what you do in chat GPT. You inject noise, you ask a question to chat GPT, hey, what's today's date? It will tell something. In general, in most of the cases, in 50% cases, it goes wrong. That is one of the error ChatGPT does with the just simple concept of date. But say you ask a question, what is this or what is that? In textbook context, it's very good at that. But suppose you inject noise, say you say, hey, I am asking this question while following conditions are met. That's the noise you inject in the system, and it generates new text, right? Which has to be realistic. When you are a doctor, you are reviewing that, you would know what is realistic, what is not realistic, whether this is correct or not. But that's more or less the basic concept. It generates synthetic data. When ChatGPT is generating the data, it's nothing but a synthetic data for you, and you are simulating it based on some sort of noise, some sort of information, and you can modulate it, right? So this is the overall concept of generative model in a mathematical way. It's in a very simple mathematical way, which is not always true, but in fundamentals, going back to the very early primitive like generative model, it starts simulating from a Gaussian noise, go to a latent space, and in that latent space, it's basically generates the high dimensional image data, in this case glomerulus data, and that latent space is something where things would make sense, not was necessarily every data point and dimension in that Gaussian noise space is useful. In principle, in an ideal world, you can simulate something from this latent space, which is this Gaussian 3D space, and you can completely stimulate a disease progression in the ideal world, which I haven't seen. Ideally, I think it is possible. It's there hidden, as long as these systems are trained enough for long time, right? So this is the concept of whole this generative model and categories of generative AI model in a broader context. Since we are talking about it, it's basically they can be classified based on data type. Like this could be text sequential data model. ChatGPT is a great example. You give it a text in, text out, or image or continuous data model. It learns the spatial relationships and visual patterns, right? It generates image, right? Categories of generative model with respect to functionality. Again, text generators are the large language model. For example, the medical application could be generating diagnostic report, right? You write something very quickly, it reads from it, and it generates a reasonable scribe for you. You as a human go and interact with it, you tell it which one is correct, which one is wrong, you interact with it in a human AI system, you improve it. Image generators, it can generate synthetic image. You can generate several synthetic image from a data, and you can use that to augment the data, right? For example, membranous glomerulopathy is a disease where we don't even get 100 whole slide images, right? It's so rare. So that does it mean that I cannot run my AI model in that data? Yes, I can, if I can augment the data. Because at the end of the day, for training our models, we need lots of data, right? Multimodal model where image and text data, right, they are coming together, right? And they can be used for image analysis as well as clinical note generation, and I can come into that more into detail later. Multi-agent framework, I think AI, machine learning, chat GPT, generative model, those are old. Multi-agent framework, this is kind of the new trend, where basically you say like, I have AI model for taking scribes of my data, I have AI model for analyzing my image, I have AI model for doing another task, and can I ask my agent so that it basically figure out what type of models I have in my computer, and it writes a natural it writes a computer code by itself, right? And put them together for a specific task. For example, we say, hey, I have scanned 100 whole slide images today, right? With their clinical report, with their urinary, like, measurement, blood report, and all these things. Can you identify for me, for these specific patients who have more than 3 grams of proteins secreted every day, and they have at least 30% sclerotic globe in their image? The agent will go and write a little script. It will accumulate all these different codes that you have in your computer, and it will start it would generate that code for you, and it would analyze the data. It sounds really sci-fi, but you have already that in your hand. That is chat gpt. 5 years ago, 10 years ago, if you had asked a computer, like a program like chat gpt, that, hey, I want to know 5 plus 2, it would have made a mistake. It would have said 10, 5, 4, 3. But today, ChatGPT is 100, always perfect for that. Why? Because you have given in the hand of ChatGPT the calculator. Calculator is another computational thing that is running in your computer. And it's basically calling a calculator, and it's doing the job, right? Why ChatGPT makes mistake in the date, telling you the date? Because ChatGPT server, it's typically make a error margin of 1 day. That's what you will notice. It was today's date, either go yesterday with a random probability, like 50% probability. I have tested it. Why it does that? Because ChatGPT server possibly is located all over the world, and it basically access that time zone, right? That is my hypothesis, but I might be wrong. And so that being said, a technical model categories for generative model, and this is again for completeness, not for this audience, but again, there are different models which came from very, very early days, and I'm very happy to see autoregressive models. When you say I'm a data scientist, machine learning engineer, apparently I'm an electrical engineer, not from computer science in background, and autoregressive model is what we electrical engineers can claim. This is where from electrical engineering, like one from other applications, autoregressive models came up from signal processing. Generative adversarial networks, variational autoencoders, those are like at least 10 years old concept. Diffusion models are new, right? Flow based model, energy based models, autoencoder variants, but for the sake of time I will not talk about that. But these are different models which basically are useful for simulating data. Text generators are, there are hundreds of text generator, and again chat gpt is one of the most known one. I don't see whether, yeah, it's there. So that being said, again, let's see an example of synthetic data. And this is an data, this has been trained in my lab using 1331 WSIs, and we trained it like 6 years ago. So, and I'm quite behind in this area. I mean, I've been keep reading literature, but I haven't done much work on this. So I had a PhD student, he was really interested about this kind of models, and he generated this, and you can see the image looks very, very realistic. Of course, you can see the staining pattern is changing from histology like HNE to PAS, but because the training set has mixed up both, but that synthetic image looks great, right? So one can generate synthetic image like that using, so this image is not real. This is basically a computer generated data. This is another example of latent manifold, like exploration of latent manifold. Remember, as I said, that you take a real image, it goes to an encoder, it goes to a congested space of a latent space where the data dimensionality is reduced with all the information you have, and then you generate the image back. And when you generate the image back, you basically challenge that synthetic image with the real image to fool the network by saying that whether the synthetic image is real or not, and you train the model with hundreds of thousands of images so that this latent code that captures most of the information about the data, and this latent feature space has the overall information about the data, and that information can be used, right, for a new set of data for another studies. If this is trained with sufficient number of data, right, say 50,000 whole slide image or whatever whole slide image we have in the whole state of Florida system or in the Shands hospital, we can now go back to a new data, new disease data, disease cases, learn latent codes, and from the latent codes we can predict for disease, right, by running, using that as part of a regression model or something, right? And one can look at the continuum in the latent space, and one can see this gradual change of the images, which could also be, right, the modeling of the disease if someone is careful enough. And why, question is why I'm showing all this, right? So the goal purpose so far in the talk was to introduce to you what a generative model is. But I lost little bit of interest 4 5 years ago, right? I was just doing this, but I was not able to connect with the medical domain. So because like you, I had this question like why I'm doing. I mean, okay, I mean synthetic data generation is cool, but why don't I just scan all the slides in Shands and just use that and train my model? Why do I have to do anything synthetic, right? So what is the motivation, right? And by now, you all, those who are paying attention, possibly is asking the same question, what's the use of this, right? So now I'll be talking about some of the clinical use where this kind of tools might be useful. But before that, one thing, while I discuss that, I will also give you some of the cautions, right? Some flags, some of the cautions, right? And one set of caution is like, remember this generative model, when we train them, right? Uh, uh, we train them based on a set of data. Now, if the rare event, for example, what happened with us 3 4 years ago, this COVID, right? It was a super rare event. It had sudden change in the overall dynamics of the world in terms of systems, biology, or science. It just happened by chance, and it was the super rare event, changed the course of the world, right? It was not part of any sort of training, quote unquote training space of understanding of clinical medicine or human biology. Maybe it was there, but it was very vaguely there, and that's why it was so difficult to manage. Same way, in your training model, if it doesn't have the super rare event, there is no way you will be able to capture it. Just imagine our dreams in our when we sleep, right? If you are dreaming, it's basically a generative model. It's the combination of all those past information that we had, right? Like past information means in this life, past information. I just wanted to be very clear. Like whatever experience we had, whatever experience we can have, and we are experiencing, it's basically simulation of that thing, and we are basically making a latent walk in that space to see things. But if certain information is not there in that training, we would never see that. For example, podocyte detachment, right, in this image, right? If this podocyte detachment on top of the capillary for a diabetic mouse who has no sign of proteinuria, this early change in this histology image, if it is not in your training set and if you don't have too many data of that, you'd never learn that pattern, and you would never be able to infer anything based on that information when that data is there in your model. This is question number two. Does it make sense? I asked ChatGPT to just please my 6-year-old daughter to create a cat image with green tummy and orange tail, right? And ChatGPT created that for me. Again, I can inject noise in the system. I can synthesize whatever I want. My daughter was so happy. But when her human intelligence, she will grow, she will evolve time by time. Maybe today she is 6 year old, but when she will be 10 years old, or maybe after 2 years, she will basically say, no, 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 this is fake, this cannot be possible, right? So question is, when a computer scientist working alone in their in a silo in their space, in the space of, like, their engineering lab, and generating all these images, they have no way to determine, for example, in this case, where you can see unusual appearance of capillary wall and endothelial cells in the image, which can never happen. You simulated it from the image. They can happen because you are making a latent walk. There are all possibilities you are looking at. Question is what level of granularity you want to see and what is your question. But still, we have to always ask the question, does it make sense, and what is my bigger question, right? For example, here you are seeing urinary flow that is incorrectly shaped, right? And that's why the caution here while connecting with that cat with green tummy and orange tail is that the learning has to be integrated, like the way we are embedded right now with the medical school. So our knowledge all the time, we work with doctors, we learn, we adapt, right? That should be the knowledge base. But that being said, I will go back that what does make sense, what is the application where you can still use this. So one application could be, imagine that we took all those old slides from Shands, maybe some of them can be in the process of discard, right? Maybe 20 years old slides, and they may not have good quality even available. The block is lost, and I only have HN stain image or silver stain image, and I want to see how the PAS stain image would look like. You can transfer stains using generative models, and that is one use I see useful. But again, proceed with cautions, the cautions I'm mentioning so far right now. Second use, other use case, it is quite within the umbrella of this first use case, is virtual staining, right? Could be, like, there are cases where I have unstained slides which I want to use for other application. Maybe I want to go through certain procedures in that unstained slide where I want to do immunofluorescence staining. But instead of doing histology staining after going through the immunofluorescence staining, which goes through all this antigen retrieval and other processes, I am able to generate now using generative model. Using just pane unstained slide, I can generate a stained slide. This would all happen based on prior training, where you can just train the model with a pair of data which are unstained and stained after, and then based on that model, I can go back to my unstained slide and generate stained data, right? Well, I have to go back to the literature to see how much is the performance barrier here, but still this is possible. And now you can use your tissue sections for various other applications, especially for immunofluorescence staining, right? This is another example. So previous one, this is for the example of salivary gland. This is for kidney. Okay, in this case, you are generating Jones silver from unstained slide. Use case 2, one can predict cell type and state from histology. So you have a histology image. $1 million question is, what type of different cells are there? Is my proximal tubular cell, is it dying? Is it in degenerative state? Is it in cyclic state? And I only have histology image available. I have, like, few dollars available, like $20 or $50 maximum available in my lab to do the research. Or even a clinician, when they are looking at the patients, they want to know, okay, these are the different state, which adds another level of data, right, in the system, right? And I think this is a quite a bit of, like, $1 million question that we are asking. And this is another use case, right, for the generative model. One example of the generative model, for example, on left side here you can see PAS10 image, right? And we ask pathologists to annotate podocytes here. The red color image, this cell, these are podocyte. This green line is the outer boundary, right? But they miss vastly the inner podocyte, because this is a 2D cut of a 3D system. And when you use the immunofluorescence image, you can see all the central podocytes that are popping up. And then predicted immunofluorescence images are this, right? Predicted immunofluorescence images are this, which shows that this is the generative model generated image, where we can show that manual annotations, while it misses vast amount of central podocyte, then the predicted model, right, it generates that. So this is another use case. Use case 3 is level factory. We know that in order to train a model, a supervised machine learning model, you need to train a computer. And in order to train a computer, right, we need annotations. One of the basics, one of the foundations of conducting computational work is segmentation. And we know that, in order to do segmentation, sometimes some of these structures, they are so complex, they're so uh so no, like, difficult, right? Sometimes it's very difficult to draw boundary along them, and draw boundary along them. So one way to use this kind of generative model, and how I can do, we can train a synthetic model generator. Once that's done, we can segment the synthetic images, and we can generate only few. Once we generate this few, in this case, there are 24 fake annotated image. I should call this as a synthetic image. And then we can train a generative model, and we can generate very many this image and this annotation pair. And that way we can kind of capture the overall variability of the data and the corresponding masks, right, which are all synthetic. But now, instead of 20 annotated synthetic image, I have 50,000 generated image and their corresponding level, which we can use to train a model to do even better in segmentation. And we have shown that, this process improves the segmentation performance. While that being said, I want to come back to my red flag, that is caution number 3. That caution number 3 is, yes, again, we sometimes we hear that, and I was just reading this article a few days ago. Sometimes people are now using Chat GPT for their, even emotional support. They are asking Chat GPT various even questions which they would not even ask to their parents, which they should first go and ask to their parents, like, right now. And this is quite of an interesting thing. Same way, I mean, don't think that, when we are generating image, and again, I showed that as an example, it's basically learning any of the physical process. So far, I talked about it may not be very clean enough in terms of granular understanding. In this case, on right side, I'm showing an image of WT1 staining. And as you know, WT1 staining, they go to podocytes, and that was my understanding when I just started the working on this field. But WTN also go to tubules. And these dots, they form these punctured regions. There might be a physical reasons behind that, but there are deep physical reasons that is behind this. Is basically, it has to do lots of with biochemistry, understanding the physical process, as well as how the light interaction that works with the tissue of the fluorescence dye. This kind of generative model never simulate and understand that physical process. It starts from the image itself. It will not eliminate those WT1 from tubules for you if your original method has already that thing. So it is this kind of method. That means what you have to be careful in the medical context. It will never learn when your antibody is failing, right? If your antibody is failing for your right, or there are like, in certain cases those antibodies don't work for various reasons, right? For batches, for new lot, or whatever very reasons, right? It would never learn about that, right? So it will never learn like those unexpected experimental errors. So just keep that in mind. This is caution number 3. That being said, I will come to the new era of generative model, which is called vision language model. Not only image, but also text. In this case, this is an image of a person who is wearing a straw hat. Image can be understood using convolutional neural network and image analysis method. We learn information from this image, and now that intrinsic information can be connected with text, which is called straw hat, right? This man is wearing a straw hat, and that information can be model using something called recurrent neural network. Imagine your co-pilot in your emails. All of us are familiar. We are writing and it's suggesting us something, right? Because it already starts learning our writing pattern from very many people, right? So that text pattern and image information, now they can be connected. And why they are important in the event in this era of multimodal AI? This is so important because now AI is little old concept. Generative AI is an old concept, right? Because it's already there. World is living with generative AI, right? Agents, yes, that's a new concept, maybe futuristic, but now we are living in the era of multimodal, era. That means we have very many data from different contexts. When we were in clinical context, it was always there, but people never thought the way we are thinking now. Anyone is going to the clinic for the case of complicated disease, they can have a CT scan for first of all, suppose someone has some heart failure or something, right? They will go to the doctor. First of all, they will do various scanning and things like that and testing. They will give them medicine, but during that process, the blood report will come back, and that will say, okay, do some urine test next day. Then they will come back and say, okay, we did the scanning, during the blood test I found like the pancreas is not working. Okay, let's do the pancreatic test. Imaging tells you something. Then they go back home, they start taking medications. During medication they might figure out the sugar level is like high, right? So in order to control the sugar level, their sodium potassium level may go down. They go for another level of test. Doctor might say, okay, then just reduce the hard medication for now, let's control the sodium potassium, right? Let's do an ultrasound imaging, because during that process this person is getting some pain in the gallbladder, right? So all these things were there in the medical domain, but we are in an era of digital domain now, where we can combine this data set. We can go to that era of multimodal AI, where we can combine this data set, make an understanding of the holistic view of the data, maybe take overall all data from Shan's hospital, right? And what we can do various things. One example is, say we have like a slide, we have several slides which could have names, but for a specific slide we don't have notes missing, and we can ask the question, tell me where in the slide is the atrophy present, and it would mark the boundary, the AI for us, right? And this can be possible when we take all the path reports, all the image, all the data, and train a comprehensive multimodal AI model. This is a brand new publication. It's coming from a very, very trustable group who are leading us. Path AI, their founder is leading us, and their tools are getting FDA approved to be used in clinic. And this has shown how generative AI can be used for image, like multimodal integration of image and language. And how does it work? For example, this is the QR code of the work you can use, but how does it work? You take an image, right? You take an image, ask the system, is there cancer? It says yes. That means you are simulating text. At the same time, you are looking at images. Then you start asking question, what type of carcinoma is present? It says then it provides more and more granular answer, and during that granular answer providing, right, you can as a doctor can interact with it, right? So that's basically text simulation, but at the same time you can also ask for similar examples, you can ask for drawing boundaries in the image, right? And those things can be done. So not only you are simulating image, you are also simulating text, right? So that's the multimodal aspect. With that being said, question is always, are we there yet? Are we there to, will you trust AI to write your medical report? Right, and in that context, procedure caution, right, the recent public like study, it asks a simple question in some popular AI model, some open source, some closed source, and ask the question, hey, I'm giving you maybe hundreds of CT images, and in these CT images, one very basic question, medical question is, liver is on the right side of the body, right? So liver is on the right side of the body, or left, I think liver is on the left, I think it's how you see that, right? So basically it asks the questions that, okay, what side of the body liver is, and it shows those images to this system and found they are not performing just by chance alone. But if you are a medical professional, I believe that this is something that would be like part of the education itself, right? It's a very very basic thing, right? Now these systems were given images which were randomly flipped up and down, left and right, and they did what they provided answer just by chance alone. And when these systems were eliminated with the medical context, they improved their performance. That says these image systems are memorizing information from the anatomy textbook and try to go better, which would be dangerous if I have some rare thing happening in our body and it could completely inform someone. But I think there are room for improvement, and I was talking with Dr. Winner and I enjoyed our discussion where he said, I think the question, possibly AI is doing the right thing, but I would train the AI, and this is his word, and which I found intriguing, that I would ask the AI to ask that, are you asking the right question? It should be at the left side, but this question is possibly wrong, and I would question about the question, right? So that's interesting. So that being said, probably when we will figure out all this, and we would be able to figure out how to reach to Proxima Centauri b, which is the nearest habitat, like, you know, like planet where humans can stay as predicted. I believe it takes 4 years, right, to go there, but or little more than that, I don't exactly know. But possibly what I'm trying to connect here is, it has nothing, the slide has nothing to do with Proxima Centauri b, but I'm talking about agentic AI, which could be the next revolution, where basically say, okay, we have several tools in our lab which can do various tasks, we have different models, we have databases, now we have a whole slide image or task in clinic, and we ask, hey, I want to execute a plan, I want to count again, like, you know, number of sclerotic glomeruli for the slides, which where the patient release more than 3 gram of protein, and it possibly would look for what are the tools in the database and whether those tools are useful, write its own code, accumulate those tools and take an action, and then doctors will say whether the results are okay or not for clinical integration. So that being said, I will be wrapping up, and my concluding remark are, as we learn, that generative models may not be themselves are useful until those are used for right purpose. So I talked about few examples. Computational and everyone, right, clinical people and computational people, they have to work under same umbrella. It's not like you work in silos, things can go wrong. AI only learns what it is trained for and nothing beyond. Adaptive learning and adjusting with changes are what makes us human special. um, Best available visual language models are still not trustable, right? And just a matter of caution, when I say the word trustable, yesterday I got an email, I wrote someone trustable and they completely misunderstood the meaning. When in AI scientists, right, these days we are talking about trustability, trustable AI is a very very common concept. right? It has nothing, no harm or no misconception there to hurt anyone. But trustable is just means like whether we can trust it or not. It has to do with explainability and beyond. Like, okay, I wanted to acknowledge for this talk few people, my old students, like who graduated from Buffalo, with whom I discussed when I was preparing this talk. Fatima Afsari, she helped me to generate the material, and Sam Hoffman was coordinating while I was preparing this talk to various people to just make sure that the contents are done in a story. Thank you very much, and I'll be happy to take any questions you may have. Did I tell too much? I guess too difficult.
No, it was a different perspective. I think I really enjoyed your talk.
Sure.
Yeah, especially, the way you presented some anecdotes and kind of made sense. So thank you for that.
Do you think yes, it will be well received in ASN? What is your feedback for someone you say you are you attending ASN?
I am not this year.
Okay. But in case, I mean, if you're attending ASN, what would you expect, right? For someone like me, those kind of feedback would be so helpful because I will be, ASN still is in November, maybe another 10 more days. If I get some feedbacks, right, kind feedbacks, I would appreciate, right?
Yeah,
Then
no,
I can just, and then my October is when I will give it to an illustrator to just prepare for that presentation because it's like a closed session. They're doing this as a special, like educational thing. So yeah.
yeah, I think ASN is really focusing on AI this year, and they have like an AI nephrology community as well. I keep getting like emails from them, so it's really interesting. And I think that for me, like not having any science background, I think you presented just enough for me to be able to understand and put it in context as well. So I think it was great.
Okay, thank you.
Yeah.
Dr. Shukla, do you have any thoughts? And yeah.
Yeah. Can you hear me now?
Yep.
Yes, yes, sir.
No, I think overall I love the talk. Obviously, I think some of these concepts that you have said before to us, so it is much easier for us to understand. I think you are right that for the nephrology community who is not involved in machine learning and AI, generative AI, I think there is a level of sort of a sort of skipping required. Uh, I think you go at a slow enough pace. I
Okay.
did have a couple of questions in terms of its application and how clinically relevant who the audience is, so that if there was a suggestion that we could make, the who the audience is likely to sort of provide a better sort of capacity to provide suggestion.
I think this is for CME credit, still nephrologist, ASN, right? So kidney week. So
Was this
predominant.
earlier? Was it
Early session. Yes, yeah.
Okay, so this is so there are so you are going to have a very sort of dedicated audience who come for these particular early sessions are registered by people who specifically are interested in that particular topic.
Okay.
So
That's
I
great.
think as long as these are well connected to clinical utilities, I think you probably even can afford to go a little bit more in details about your generative processes, and because these people are coming for with a specific interest of learning this because their research or applications are actually hinging on it.
That's a great feedback. Thank you. I think that's really a great feedback. Yeah. All right. I guess we got now 2 minutes over. So
Thank you, Dr. Sarder. Thank you, everyone. And the
thank you very
candidates,
much.
I'll be there in the main meeting room.
Thank you.
Have a good weekend.
Great talk.
Thanks.